Gavan Reilly joins us now on this breaking news. So, Gavan, the Taoiseach is set to leave Washington now.
That's right. It was a week ago this evening that the Taoiseach got the somewhat unexpected news that he had tested positive for COVID-19 in a PCR test. Only the night before he was due to meet Joe Biden in the Oval Office. As you heard in Cleona's report a moment ago, Joe Biden is on his way to Brussels. He will be at the European Council tomorrow, and now we know for certain, so too will the Taoiseach. Perhaps the possibility of a face-to-face encounter between the Taoiseach and the US President after all. That announcement from the government coming on the cusp of two negative tests that the Taoiseach has undergone in the last couple of days. He'll be flying out of Washington this evening and will be representing Ireland at the European Council in Brussels tomorrow, which is important from Ireland's perspective because the European rules do not allow for someone else to take his place. He would have to basically recognise another country as speaking on Ireland's behalf if he wasn't able to attend. He hasn't, however, has been luckier than other ministers. Today, Helen McEntee, for the second time, testing positive for COVID-19. She is now self-isolating, as too is the Minister for Health, Stephen Donnelly, who does not have coronavirus but has developed flu-like symptoms and is isolating until they clear up. All of this coming on the day when the country had its highest one-day increase of hospital numbers of people with COVID-19. There's now 1,395 people in hospitals with that disease, 225 of whom were only diagnosed in the last day. But Leo Varadkar says there is no need to be worried because so many of those people are not actually being treated for the disease.
What we currently anticipate is that COVID is going to be with us for eternity. There will be future variants, there will be future waves, but because we've got to the point where we have a highly vaccinated population and because we now have treatments, effective treatments for COVID that prevent people from being hospitalised, we should be able to live with it in the way we deal with, for example, the flu virus or RSV or other viruses that have been with us for centuries, and that would allow us to avoid having to impose legally binding restrictions.
So Leo Varadkar effectively saying the current level of COVID-19 can be lived with, and pointing to the fact as well that around half of all hospital admissions now who are testing positive for COVID-19 are not actually being treated for that disease. Today's figures show that of the 225 people admitted to hospital, only 99 of them had a positive diagnosis before their admission. Leo Varadkar also saying that although NPHET has now been stood down, that a new advisory body to give advice to the government about its future for the coronavirus will be formed imminently. In the meantime, it falls to the Chief Medical Officer, Tony Holohan, to offer any advice to the government if they believe that anything is needed. Worth bearing in mind, Colette, that this day week the government's ability to issue new emergency powers expires, so there clearly does not appear to be any appetite on the part of the government to consider issuing any new ones.